All right, I bought a new topic, and that is biliary disease. Initially, when I was studying, I used to interlink these terms and test my knowledge because I found it very challenging to remember all this stuff to start with. So, firstly, what is biliary disease? We have the liver, and just below this, we have the gallbladder. In the gallbladder, there will be biliary ducts that propel the bile acids and bile salts out towards the pancreas. In case of primary sclerosing cholangitis, the bile ducts are undergoing something like a calcification. There will be beaded appearance. You diagnose with ERCP, or you can diagnose with ultrasound. So most of the times it is a cholestatic pattern. There will be increase in the bilirubin levels, and that too the direct bilirubin, and there is increase in the alkaline phosphatase levels. Okay. This alkaline phosphatase is released from the placenta and also from the pancreas or also from the liver. Anytime we see these kind of elevations, you may think about cholestatic pattern, meaning the bile duct is obstructed, let's say distal to the obstruction. Now, whenever there is obstruction due to stones or due to infection, there is a stasis happening on the proximal side. Whenever there is stasis, this acts as a nidus for infection. Okay, so this infection is what we call as cholangitis. Primary meaning anything, whenever you see primary, it means we don't know the cause. And most of the times it turns out to be autoimmune. Maybe there will be some underlying celiac disease, or maybe there is Crohn's disease. So we need further investigations in these cases. Now, what is cholelithiasis? Cholelithiasis is gallstones. This is typically happening in the middle-aged individuals, 40 years. Just remember 4 Fs. Female fertile fat 40. Okay. So, and then if the person has symptoms like pain, you may want to consider surgery only if the patient has symptomatics. Most of the times, the symptoms are not there. Okay. However, if patient complains of pain in the stomach radiating to the back or to the shoulder, it is concerning. And most of the times, the gallbladder contracts to get the stone out to through the bile ducts. So when it contracts, we experience something like the colicky pain. Okay, so colicky pain is like a very common complaint, meaning the pain comes and goes, intermittent pain, or it'll be more like a squeezing kind of pain. Okay, and then let's talk about choledocholithiasis, meaning this is a gallstone. Okay, so when during its process of propelling forwards, it gets stuck in the bile duct itself. So when it is stuck in the bile duct, we call it as choledocholithiasis. Next, coming to cholecystitis. What is this? Cystitis, itis meaning inflammation. So whenever the gallbladder is inflamed, we tend to have right upper quadrant pain. So it is diagnosed with ultrasound. Sometimes the gallbladder wall is thickened enough, or sometimes there is a lot of infection buildup that can lead to stasis and bacterial infections. So this is also something to be concerned and to be treated um, immediately. Now, if a patient has a very high grade fever, along with right upper quadrant pain, fever, and jaundice, then this is a great a patient to simply admit this patient. This is cholangitis. It's a very critical situation. You need to treat it immediately. In this situation, we also talk about Charcot's triad. They will present with altered mental status at times. So intervention is to be immediate here. Now, what about porcelain gallbladder? Some instances when we are doing ultrasound, the gallbladder itself appears like a calcified organ. Okay, something like the name suggests. It's like the glass bladder. Glass gallbladder, in this sense, it is calcified. Now, whenever you see such instance on the ultrasound, you immediately have to remove the gallbladder. What is the reason? There is increased risk for it to turn into a cancer. So we need to remove it immediately. Okay. So that is it. If you have any other doubts, do let me know in the comments, and I will be happy to learn and go through what you have to talk about. And it's always a good way to remember things like this. Okay. One last point I like to include is something like acalculous gallbladder. Means acalculous in the sense cholecystitis means this is hypoperfusion. It can be due to infection, due to stasis, and this is more likely seen in critically ill patients. Think of doing Murphy sign, and then start your workup with HIDA scan. Okay, HIDA scan is suggestive of obstruction in the gallbladder. Okay, so whenever we do not see, classically we start with ultrasound. If we don't see anything much on the ultrasound, we want to go ahead with a HIDA scan because this will be 100% sensitive and specific in ruling in the diagnosis, ruling in the obstruction. And remember, this is only for cholecystitis. So that was a lot. So I hope this video was useful. And thank you so much.